One ambulance, rigged with cameras for the first time ever, to show you what goes on behind closed doors. Body-mounted cameras record everything.
Oh, it's going to be another 2-hour session of wearing the man bra.
Hello, you okay?
Am I turned on? Oh, no, I'm not. No, I'm not.
Apparently it's going to be a fisheye lens on it. It's going to make your face look even fatter than it is.
Where's the button, Jamie?
It's there.
We'll reveal what it's really like
So where are you hurting?
to be a paramedic.
Hello there, Lawrence.
Do you know what? High five, Joe. Well done, love.
We're with the West Midlands Ambulance Service.
We get life, we get death. We have a bit of everything.
As they deal with 3,000 emergency calls each day.
We're not in the Bronx.
Yes!
I think it's red one, let's go. Blue light.
Taking you right to the heart of the action.
You comfy there?
Not really.
All right, that's the worst bit over. All right.
My lips are so sore, it's unbelievable. Right, where are we going? Willenhall.
That Vaseline, your lips are pouting now, girl.
My lips are pouting. Are they really? Because they're so sore.
No, leave it on. It just got that lovely shine off of it. It looks like you.
Don't.
Yeah,
You're not
really
kissing
does.
me.
No, I never said I was going to. That Betty Boo kind of pout.
Yeah, but I just haven't put it on my lips. I put it all over here as well.
I know, we
it's sore.
noticed. Right up to your nose. It makes
Does
your
it-
lips look
does it
about
look
an inch
funny?
high.
Does it
Your
look
lips look
funny?
about an inch high.
I once went to a job where the family, we'd dealt with the patient, we'd done our assessment, and we were about to take them to the hospital, and the family said, we're just about to have dinner, can we interest you in some dinner? And I was like, no, honestly, I'm fine, thank you. No, you must have something. They literally laid out a 3-course meal for us at the table.
What?
Honestly. We didn't stay, obviously, for the 3-course meal. However, they very kindly did do us a little doggy bag, so it literally kept us going the whole shift.
Michelle McNulty and Hannah Simpkins have just come off a break.
Are we ready for this?
Cool.
And within seconds, they get a call.
What we got?
16.
Thank you for contacting to Red Backup, case number 823 over.
Received a mobile over.
So we're going to a red backup for a gentleman in his 40s, clear left, who is suspected of having a stroke, apparently, who keeps collapsing and he's got speech difficulties. Nice skills, busman, nice skills. What's all going on today, mate?
A rapid responder is already on the scene with the patient, who's extremely distressed.
Let's get you, don't be frightened.
We're here to help, Paul. There's nothing to be frightened of.
Paul suffers with crippling panic attacks.
On the get.
He works in a warehouse packing car parts, but has been off sick for 6 months.
All right.
There you go.
Can't control.
Can't control.
No.
What can't you control?
Feeling.
The feeling.
What feeling's this? Hey?
No.
Yeah.
Right.
It's okay.
Paul,
It's okay.
there's nothing to be frightened of, okay?
It's okay. We're here now, all right?
I need somebody I know. I need somebody I know.
You need someone you know.
Your friend's going to try and contact your wife, okay, Paul? Yeah?
6 months ago, Paul was diagnosed with severe anxiety and depression. He desperately wants to talk to his wife of 23 years, Mandy.
Should we try and do it again?
You can't ring no credit.
You got no credit?
We can ring Paul, don't worry.
Paul's been on anti-anxiety medication since his diagnosis.
You say it was your first day back at work today?
Yeah. Yes.
Yesterday?
I
Has it all been a bit too much?
was frightened yesterday as well.
You was frightened yesterday?
No, nobody's seen it yesterday.
Did you tell
Nobody's
your
seen
wife?
me break down.
Did you tell your wife?
Yeah.
Yeah, and what did she say?
She said he would get ease. But today
It didn't feel easier?
people wouldn't talk to me.
You can
I
talk
felt
to
all
us.
alone and frightened.
Okay. You feel sick? Silly? You're not silly. You're not silly.
We see more and more people like Paul in his situation every day. Every shift that we come in, it just seems to be on the increase.
There's still a massive stigma attached to it in society. So they try and cope with it for as long as they can and then get to the point where Paul had got to, which is like a sort of crisis.
Okay, let's just take some deep, calm breaths in. That's it. Let's just try and slow the breathing down a little.
Paul tries to use a technique he's been taught by his specialist.
Oh, yeah.
Square breathing.
Square breathing.
Kept around the square.
Okay.
Breathing on the sort of parts and out on another.
Does it help?
A bit.
Yeah. And what about your GP? Is he aware of everything?
Yeah.
And he knows that you went back to work yesterday?
Yeah.
So was it his recommendation that you went?
No. I said I wanted to try. It was on the last day and I was frightened about losing my job.
I think maybe stop worrying about that for the minute. And at least you know you tried, didn't you?
I do.
It's a very brave thing to do.
And my last 3 jobs before this one, I was physically bullied, mentally bullied.
Mm-hmm.
I can't take anymore. I've tried.
We know you've tried.
I can't do anymore. I can't do anymore. I can't do it. I need someone to talk to, please.
Do you want to try and call your wife again, Paul?
Should we try and call her?
Yeah.
Is it Mandy? Do you want to get Mandy's number up and then we'll try and give her a call?
Paul met Mandy 33 years ago at a country and western night.
There's nothing else on there, just 3 numbers.
Mandy Mobile. How old is she? Your daughter? 8. Oh. How old are you, Paul?
57.
You're 57.
So I won't get another if I lose it.
Try to stop worrying about that for now. Alright, we'll get you somebody to talk to.
With Paul's breathing slowing down, Michelle wants to examine him.
What's happened to your arm here? Does this work? You scratched it. How did you do that?
I was taking the printer apart at
Oh, okay.
the wife, she knows about it.
Okay.
It's nothing to do with self-harm.
Alright, love.
I've been thinking about it, but I don't do anything.
Okay.
It's just horrible thoughts that go through my head.
Honestly, Paul, really, don't worry. Don't worry. Okay. Is it... Sorry, can I just take this finger, Paul? Is it more that you're sad or that you're angry or...
I thought that losing everything...
Sharp scratch. Well done. When you say that you're frightened of losing everything, obviously I know that you've already said your job. Is there anything else that you're frightened of losing?
I won't be able to support. I can't support.
My name's Hannah. I'm a paramedic with the ambulance service. Is that Mandy? We're with Paul at the moment. He's left work because he's not feeling particularly well. So we're going to pop him up to the hospital. But obviously he wants somebody there for you. Got a cough.
Michelle McNulty and Hannah Simpkins are helping Paul, who suffers with severe anxiety. He desperately wants his wife, but a phone call to her got cut off.
Let's try and control this breathing again. Paul, look at me. Paul, slow down. Slowly, deeply. That's it. Big deep breaths in, Paul. Deep breaths in. You're panicking now, come on. You're panicking now and there's no need to, is there? I know. It's Monday.
All right, Paul. We'll get this through. Hello. Hello, is that Monday? I just want you to know, we're with Paul. He's obviously told us about what's been going on and the way that he's been feeling recently. Okay. What we're going to do is take him to the hospital. We're going to take him to Walsall Manor, but we were wondering if you could come up to the hospital to meet him, because he obviously wants to have someone to talk to. Okay. All right, that's brilliant. Thank you very much. Bye. She's on her way, Paul, all right? She's going to meet us at the hospital.
After spending 40 minutes trying to calm Paul down, they prepare to head to hospital.
What's up?
Feeling nervous.
What do you feel nervous about? With Mandy? Because you've let her down. You haven't let her down. You haven't let her down at all. You tried your best.
I thought I could do it.
And you still can.
Oh.
Do you know how brave it is for you to admit? Eh? And look for help and want help. Yeah? Because you want to be there for Mandy and for your daughter, don't you? You haven't let anybody down. You really haven't.
Would go to hospital.
Oh no. You just need to remember there's people here to help you, all right?
I don't understand.
Come on, Paul, look at me. Paul.
Please,
Hey, no one's saying that you've got to stay.
I am not mad.
Paul, no one's saying that you've got to stay, right?
I'm not mad.
I know you're not mad, and you know you're not mad, right? Try and keep yourself calm, okay? Do that breathing again with the square. Let's get the square and let's do the breathing again. Okay? That's it. That's it. Well done. Han?
Yep.
Can you see if you can get straight into a cubicle?
Yeah, mate.
Don't be nervous. Don't be nervous. Come on then, bring that with you, because that's really effective. Mandy's on her way up, right? If you can stand up for me. Come on. You're not on your own, I'm with you. I'm with you. Come on. Come on. I know.
Room ready just for you, all right?
Come on. That's it. Well
done, Paul.
Michelle and Hannah are straight on to their next emergency call. But Paul is still on their mind.
I find it difficult with those because you don't always know what to say.
Yep.
So difficult having not been through something like that, you know what I mean? And
I feel quite exhausted, actually.
It's
It's like really mentally draining, isn't it? Like trying to just keep them talking and try and take their mind off it and get them to just focus. I mean, keep getting him to try and focus on the breathing and stuff. That was a really good technique, though. I don't think I've ever seen that before, the square with the counting.
I've heard of it.
Yeah.
Smashed it, dude. Smashed it.
What is the most you've ever eaten on shift?
The most I've eaten on one shift was Christmas Day just gone. I did a 9-9. So I went to my mum's before work and she did breakfast. Because we were working Christmas Day, we were going to have a good time. We made the truck into a reindeer. We've got reindeer antlers and a red nose on the truck. We've got tinsel everywhere. And I'd bought like a Christmas picnic. We've got enough food to feed an army. We've got sandwiches, sausage rolls, all your little party food, crisps, Christmas cake. We've got tins of chocolates. Literally, we did not stop eating.
It's when you have to loosen your work belt. That's when you know you've eaten too much in a shift.
Paramedic Dan and student paramedic Shane are at the start of their shift. Shane is halfway through his paramedic training.
I've got that stuck in my head now.
What?
Casualty theme tune.
That programme makes me laugh.
Oh, do you know, I don't watch it anymore. I used to just sit there shouting at the TV.
My wife watches it religiously every week. There was one episode where they went to a train crash, a massive RTC, and a guy had fallen through a roof, and I'm like, I can't even get one of them in 6 years.
Yeah.
Do you know, and they all go to the pub at the end of shift and have a nice drink, because they're not, tired after their 12-hour shift.
RTC in Willenhall. Car versus van. Definitely one patient, possibly road is blocked. The police have been informed and should be en route.
Since Shane started, he's only attended one serious car crash.
51-year-old mate.
Chest, head and leg pain.
Are you going to bullseye the windscreen? Was he wearing a seatbelt?
So obviously the key thing with this is if he's got chest pain, is it from the crash or because of his age, has he developed chest pain while driving?
Shane's training takes 2.5 years in total. And when he qualifies, he'll need to take the lead. So Dan wants him to take control of the scene today.
Shane, I'll bring the kit, all right, if you want to go out.
No worries.
Shane's body-worn cameras record everything he does at the scene.
Hello, you all right? So what's happened?
I was leaning, I was forward, trying to get my book to write something in.
Uh-huh.
My chest is hurt, mate. My head at the top. I cut my hand, and they wrapped my hand up. I think I hit my chest on this. Mate.
No, had you got your belt on?
Yeah,
Seat belt?
yeah, I got it pulled, stretched forward, so I could get into my...
OK, so you've come forward, then you've flown back?
And I've flown back, yeah.
OK.
And my legs hurt.
With the patient complaining of multiple injuries, Shane needs to do a full assessment to work out which is the most serious.
Stay nice and still for me. I'm just going to have a feel of your neck and your back for pain. Just lean slightly forward just so I can get round to you. Have you got any pain here?
No.
Anything down here?
Yeah, a bit down there.
There?
Yeah, a bit down there. Yeah, a bit down there.
How about here?
Yeah.
Yeah?
Yeah, around the back. A bit down the back, that's all.
Right, OK. You have to stay nice and still for me.
I've got my leg. My leg's hurting, mate.
Whereabouts is the pain in your leg?
Down here.
It's right the way down. Have you hit your leg off here?
I think so, yeah.
OK.
All Shane's training is kicking in.
Have you got any head pain? We'll work way down just to make sure we don't miss anything.
I don't know.
Bit of a headache?
Well, I've got a bit of an headache, yeah. But,
any chest pain?
I just seem like I can't breathe.
Chest pain is significant in an RTC because it can indicate life-threatening conditions from a heart attack to a collapsed lung to a flailed chest to any major trauma to do with the chest.
The patient is also suffering from pain in his back.
Because of where you complain of the pain, it's right on your spine. So we're going to have to put your collar and board. All right. It's just where that pain is. All right, that pain's in the centre of your back. So that's a bit of a concern for us. All right.
As the lead at the crash, Shane needs to coordinate the other emergency services.
Hello, you all right? All right, he's got C-spine tendon, so he's going to have to be mobilised.
Yeah.
So how are we going to get him out?
Well, I've got the fire coming. So
Oh, they come in?
Yeah.
Oh, cool.
Shane and Dan have had to split up to deal with the patients in both vehicles. But Dan wants to check student Shane's assessment. A spinal injury could lead to paralysis if not dealt with correctly.
So just C-spine, no chest pain?
Chest pain, everything really.
Are you happy for now?
He's got pain everywhere, to be honest. Chest pain, all sorts, but we'll have a look.
The patient is a civil engineer and was on his way to work when the crash happened.
Last thing we want is you getting out yourself and then you end up being paralysed or something because of some tenderness going on, all right? Pop your finger in here for me. Nice, pop these on your... Where's that pain? Just where I lightly touch there. Is that painful as well? It's never that tender.
A car and a van have collided during early morning rush hour. The passenger in the van has suspected spinal injuries. 2 fire crews and another ambulance crew are on scene to help student paramedic Shane get his patient out safely.
Just get hold of his arm, miss.
Yeah.
Shane, how are you getting him out?
They're thinking about sliding him out, I think, onto a board.
So you don't need a helmet?
Just in the side.
Finish with the obs?
Yeah, that's what I've done at the minute.
We're just going to need to go and have an X-ray on her arm, but if Rob's are fine, the dad's going to take her. You comfy there?
Not really. I don't know how I've got into this position. Have you got any movement in this leg?
Yeah, I can
Just
move.
slide,
I
but
can
is that
move.
painful?
You know when you'd be playing football at school and you'd have somebody with a studs take all your...
I don't know, I never played football as a kid.
That's what it feels like.
Okay.
Is your weight on this door, mate?
No, mate, yeah, I'm all right. I'm not leaning on it, mate, no.
Okay, mate, we're just going to have
Yeah,
a go now,
okay, no problem, mate. Yeah, go on. Okay.
Hey, you'll have a new door on your van, won't you? I hope the match the paintwork for you.
It's been running to 3 times.
All right.
So that leg you can actually...
This leg's okay.
That one's all right.
This one's okay, yeah.
Can you get that one out the footwell? That's it, that's it. And we want to twist you around a bit now, mate.
Yeah.
Sorry, Bob.
You're all right, no problem.
Okay.
You got me?
Yeah.
Oh.
Sorry, Bob. Hang on, is he caught on something there?
Oh, it's just on that catch.
It's
That's it.
trousers.
We're off.
Tight. 1, 2. Perfect.
With the patient safely out of the vehicle, Shane can extract himself too.
Shane did really well. He's coming towards the end of his training, so you have to let the reins go as a mentor in order to let them experience firsthand what it's like. Has it been a learning experience for you?
Yeah.
That doesn't mean giving you all the pressure and all the responsibility. It's me making an assessment on where you are.
Yeah. Overall, I think we're good. We assessed both patients. We knew what they needed.
I mean, I'd do it exactly like that again if I turned up to a job like that.
Shortbread?
Not while I'm driving, thank you.
Oh, yes, that's the political answer.
Both hands firmly on the steering wheel at all times. Apart from watching TV.
I'm having to resist putting my feet up on the dash.
Yeah.
Mike Arrowsmith and Gaz Clark are starting to feel the effects of a very long night shift.
Oh, God. You know when you blink
your eyes and it seems so nice to blink.
Yeah. Takes very.
The blink gets longer and longer. 2 minutes of the shift, we've been pulling onto station, the gates have been opening, you've been given a job. It's turn round, it's go. If that job's going to take an hour, it's going to take an hour and a half. It doesn't matter, you've got to go.
Yeah.
In the final hour of this morning's shift, they get a call to a woman struggling to breathe.
Red 2. Clear left, all clear, clear. Shortness of breath, warm to the touch, chest, upper back pain, features of cardiac pain. Who are we going to go and see? Denise.
Gaz and Mike arrive on scene. Their body cameras capture everything firsthand.
Upstairs. She's in the bathroom. She's just got up because she's been sick.
Right.
But went to bed early last night, feeling a little bit sick. But woke up this morning,
Right.
shaking, couldn't get her breath. She's had her inhaler.
Hello, my love.
And what have we? But she's, well, you can see the state of her.
Let's have a sit down.
Where are you going to sit down?
Where do you want to sit down? Sit down.
Have I got to sit? Yeah.
Yeah.
Well, yeah, you can't really stand up, Babs, if you're shaking.
Freezing, Graham. I was going to.
Doesn't matter.
Well,
Just sit on the side of the bed.
Denise and Graham have been married for 53 years.
No,
I'm
just
so
relax.
cold.
No, you're not cold.
What is it then?
No, you're not cold. If you've got a bit of a temperature, it
I've
makes you
used my
shake as well.
inhaler.
Yeah. How many puffs of your salbutamol did you have?
About 4, did I say?
Just put your hands on your lap. Right.
With the salbutamol, if you have quite a few, that can also give you the tremors and a bit of a shakes.
Although Denise is worried by her shaking, it's her breathing problems that are more of a concern to Gaz.
My fingers were numb.
Will it?
My hands and
Pins and
fingers.
needles?
Yes.
Cramping?
Yes.
Yeah.
Because you're breathing
Too fast. What do you normally suffer from? Asthma?
No, COPD mild.
Mild COPD?
80%.
COPD, or chronic obstructive pulmonary disease, leaves the airways inflamed and the air sacs in the lungs damaged. The patient often has a tight chest and can't get their breath.
80%, so I've got 20% lung capacity.
Right. Is that 20% left or 20% gone?
What's the difference?
Are you working on 80% of your lungs
Yes.
are working fine?
Yes.
Yes, right.
Sorry.
The other way is not very good. Yeah.
20% is not very good.
Is not very good. But you see, when I asked you that question, you suddenly paused and what the hell are you on about? You stopped shaking.
I did?
Yes, you did. When something goes wrong, especially with our breathing, we cannot help but panic. Adrenaline's released into the body, upping your pulse rate, and that automatically ups your breathing rate. Perfectly normal. OK, so you're calming down nicely now. Right, we'll take that off.
She was fighting not to panic.
I was.
But
Yeah.
she is a
Taking deep
fighter,
breaths.
which worried me.
With Denise calming down, Gaz needs to do more checks to see what's making her feel so unwell.
Right, 39.7. That means you've got a raging temperature. That's why you're shaking. When we get a high temperature, we actually shake. Yeah? But because when we're kids, we know when we go out playing snowballs and we get cold and we start shivering,
Just on your head.
your body's now shivering and your mind's going, oh, I must be cold.
Yeah.
It isn't. It's
It
actually
isn't.
toasty.
Is it? What's
Yeah.
causing it now?
Very toasty.
An infection normally.
Yeah, well, I've had an abdominal... No, what have I had, Graham? I'm getting completely off for 3 weeks. I've been on antibiotics.
You've had a tooth infection.
And tooth infection.
Yeah.
Which I've still got.
Still going on at the moment.
Her GP has prescribed antibiotics, but they haven't got rid of it.
I need to just...
Yeah, go on. You're free.
Did you bring that up?
Just a bit, not much.
Not much. Right. We'll get you a little drink. We'll get you 2 Cocodamol. The paracetamol will artificially lower your body temperature down, which will make you feel better, which will stop you shaking.
Yes.
OK? Like you've suddenly stopped
Certainly
shaking now.
a bit, I have.
Yeah. Every time I'm
I've
talking.
tried to control
Must be the
it.
constant drone on my voice. It's sending your body to sleep again.
It does to me all night.
Yeah, if you want to have a little sip, wet your whistle first. Although you're calming down now, your breathing's absolutely fine. We do know about the higher temperature, which is going to be because of your infection that you know you've got going on. So that's perfectly understandable. We need to make sure that the paracetamol that you've taken just starts to work, starts slowing your body down and you're nice and stable. So ideally wise, if we take a little walk downstairs, we can do some paperwork. And what's your name, sir?
Graham.
Right, Graham can put the kettle on then, can't he?
Yeah, oh yes, that's good.
Right, yeah.
In the time it takes Gaz and Mike to do their paperwork, they can already see the effects of the paracetamol on Denise.
You've now got plenty of colour back, you've stopped shaking, and I'm sure you feel a bit better now.
Yes, yes.
We can take you to hospital if you want to.
No, I don't want
No, I don't blame you.
I mean, no.
If I thought you needed to go, I wouldn't give you the choice.
Oh, thank you ever so much.
No problem. If I could trouble you for a signature, that's it. If you use the sharp end of the pen, it tends to work better. Yeah.
Thank you ever so much.
No problem at all.
You're very welcome.
Yeah.
Thank you.
Have you got any more calls before you go to bed?
No, well, we finished quarter of an hour ago.
It's 7:15 in the morning and time for bed.
Oh, don't start.
Oh, gosh.
999 mode activated.
It's 9 p.m. and Steve Geno and Neil Weaver are on duty until the early hours. They're responding to a call from a GP who's rung 999 on behalf of a very young patient.
15-month-old female, difficulty breathing. Call's been made via a doctor. Patient has got asthma. Please.
All received, mate, thank you.
Thank you. Bye.
For a baby who's struggling to breathe, it's blues and twos, lights and the siren.
Stop there, you numpty. Jesus Christ. Even this copper doesn't know what to do for the best, does he? That's the first time I've overtaken a tram.
Is it?
Yeah.
Despite the traffic, they arrive at the house in just 6 minutes.
97, 95, that one there.
And the baby's mum is waiting for them.
Hello there.
Hello.
You all right?
You okay?
Not so bad. How do you all right? Is this Poppy, is it?
Yeah.
Right. What's been going on with her then?
Neil and Steve have been called to a 15-month-old girl who's got asthma.
Right. What's been going on with her then?
For the last 4 days, she's been really barking. Like, I took her to... I had an ambulance out on Sunday because she was struggling to breathe. She's got asthma as well. I said it was a viral. I took her to my doctors today. They've said she's croup. Hello. And I can't find...
Poppy has a low immune system, so she's more susceptible to germs that other children might just fight off.
But she's just been really struggling. And it's day 4 now, she's just really struggling.
She's been really sort of barky with it as well, like.
Yeah.
The doctor did give her a prescription, but Poppy's mum hasn't been able to find a pharmacist who stocks it.
And I've found literally every chemist.
Are we all right to do a few checks on her and that? Is that okay? How's she been in herself generally?
Miserable. Apart from that.
Apart from now.
She seems all right, doesn't she?
Yeah.
Poppy, hello. Can I put this on your chest and have a little listen? What do you reckon? Yeah? Are you wanting to...
Have you noticed that she's had any sort of like a throat's been sort of like sucked in at
No,
all?
it's
Or
not, but I've just been sitting
like
there
that?
and her ribs have been like,
You've
really
been-
like
yeah.
in.
How about if you put it on your back?
Yeah.
The problem with children is though they can sort of like cliff edge, even though they look all right. They sort of compensate, and all of a sudden they sort of drop and become very ill quite quickly. Eating and drinking as normal?
Not normal, because her throat's really sore through coffee, so she's finding it hard to swallow.
Can we put this in your ear? Is that okay? Well done, well done.
Okay.
37.5, so she got a little bit of a temperature. It's just to check her blood sugar levels, because with kids they can drop quite quickly.
They give Poppy Calpol to bring down her temperature, then prepare a special seat for her in the ambulance.
It's only to keep you safe.
There you go. Who's this? Who's this? Who's that?
wants to go in the wash. I'm going to try and get it off you to put it in the wash.
Push it down with it. Don't put the washer on. How is she when it comes to using the inhaler?
Fine. She comes straight over to when I've got the thing get ready for her.
She?
She'd help and she just takes it lovely.
Like a model kid then, ain't you, really? With children, the main battle is getting them to sort of trust you, and so if you can interact with them, if you can sort of like make games and things with them, then that's half the battle, really. Like, yeah, leave me alone. Where did you go? Where's she gone? Where's Poppy gone? Oh, there she is. Oh, she's gone again. Right, we're here now.
We'll see if Pete's is open, mate. Oh, God, there's 2 trucks here already.
Ready?
They take Poppy straight into the children's A&E department, where she'll have to have an X-ray on her chest to see what's making her consistently ill. With Shane and Dan. It's lunchtime, and they're racing to a 79-year-old diabetic. She's unconscious in a cafe.
Well, it's the perfect place to be in if you're going to have a hike, though. A cafe.
So we'll have one of those?
Yeah, Penny needs a bacon sandwich to bring her sugars up, and we're feeling a bit busy as well.
Yeah.
Oh, glucagon or glucose? Tough call.
Arrived mode activated.
They arrive 7 minutes after getting the call.
Hello.
You all right? How's it going? What's going on? Sure. Right.
Val is just starting to come round.
Val, how you feeling? She take insulin? She diabetic? Tablets or... yeah. Val, sharp scratch.
They immediately test her blood sugar, but it's normal, showing her diabetes is not to blame.
Val, can we get your arm out of this jumper? Is that a yes, but... there we go. Let's take your arm out. You got any pain anywhere? Headaches? Dizziness? You just feel tired?
A bit of dizziness, maybe.
A bit of dizziness.
Couple of bumps as we go out, Val. There's the first.
They've tested Val's blood pressure and discovered it's low. They move her into the ambulance.
Fainting episodes are always worrying in the elderly. The main worries are cardiac. We have to rule that out and be 100% sure on that before we decide a plan of action for our patient. So what were you doing in there? Were you having something to eat?
I just had a little drink, yeah.
Yeah. Did you felt unwell today?
Not really.
Did you go hot?
You might have been, yeah.
Yeah. Did you pass out, lose consciousness?
No.
No,
Don't think
nothing
so.
like that.
No, I don't think I did.
No.
Just an old lady.
Well, yeah, but you're very clammy as well, so something's happened.
I don't know.
So we need to try and get to the bottom of it when my colleague comes back, see what we can do.
All right.
So how well controlled is your diabetes?
I don't know. I don't bother with
You don't bother with it?
Not now.
What's your address?
What I think now. 30, I don't know, I forgot.
Should we ask your husband when he's had his cuppa?
Better.
Yeah, otherwise you're not going to get home, are you?
No. Getting on a bit now.
How old are you?
30.
What day and month were you born?
It's in December, my birthday.
And what day?
What day?
You got to know this, otherwise when are the presents going to come?
Am I going to have any presents?
Well, you've
that's
got,
all
well, only if your husband knows your birthday.
Yeah, of course.
Here's a man with a plan, bringing his brew with him.
Dan's still no closer to working out what's wrong with Val.
Calm down a bit. What happened?
Well, she just had her dinner, as normal, having a coffee.
What she had for dinner?
And we've talked into it, and they're having a mini veggie, which is scrambled egg, beans, tomatoes, hash brown.
It's nice.
Quite a variety.
And then did she just go a bit dizzy, a bit woozy?
No, I just spoke to her and gone. Couldn't wake her up.
Okay.
I didn't know that.
No, you wouldn't know.
So she's got diabetes.
Yeah.
She diagnosed with any dementia. Yeah.
Just mind your arm on this side. I'm just going to drop this side and you can swing your legs round. Sit yourself up, see how you feel when you're sat.
Where do the legs go?
On the floor.
Okay.
Bless you. Oh, do you want an arm?
Val's temperature and heart rate are fine, and her blood pressure has returned to normal. So they want to see if it drops again when she stands.
How do you feel stood up?
All right.
Okay. It's normal for her to stand like this.
Okay.
Has he got to hang on to something?
She has.
Val took a while to get back to normal. We'd ruled a majority of things out with the observations we could do. But in the end, everything was fine.
What do we do?
Well, I mean, it's a lot of trouble for the hospital because...
It's never trouble for the hospital, OK?
Yeah. Take her home and then we'll phone the doctor.
Yeah, that's better.
All right. Straight home and let him look after you. And you look after him.
We have for the last 58 years anyway.
Don't stop now then. There you go.
Shane helps Val to the car, just to check she's OK walking for the first time.
Look at them sweets you've got in there. Those sweets. No wonder your sugars are so high.
It's nice, don't you? That's right.
A lot of people focus on these horrible medical conditions, your cancer and, you know, strokes, heart attacks. However, dementia, I think, is brutal. Because you lose that person piece by piece to the point where they're incomplete now and you've lost them. Mentally, they're not there. But inside, the person is still in there somewhere. They just can't access it.
Yeah. You've got all these memories. It'll be a lifetime to get. They can't even remember. They don't even know who you are, do they? And it's just like, that must be awful for the family. And
the van passenger needed 10 stitches to close the severe slice in his hand. It was put in a cast and he then needed physio to rebuild the muscle. He was unable to work for 3 months. Poppy was given steroids to treat the croup and discharged. Despite tracking down the GP's prescribed medication, her low immune system continues to cause problems. She's since suffered tonsillitis. Denise went to the GP 2 days later. In addition to her infected tooth, they discovered she also had a urine infection. She's on antibacterial tablets and her doctor is doing further tests. Paul sees a dedicated nurse for therapy sessions and takes anti-anxiety medication. He's being reassessed by his local mental health hospital to see if he needs further treatment. He hasn't been back to work.
Should we go?
Yeah, let's go on.